Why does healthcare in the United States cost more than anywhere else on Earth? Not a little more. 2, 3, sometimes 10 times more, for the exact same procedure, the exact same drug, the exact same 15 minutes on the exact same MRI machine. An appendix removal costs about $1,500 in France. In the US, the average bill is over $33,000. That is not a typo, and it is not a mystery either, once you follow the logic. There is no single villain here. There is a chain of decisions, made over 80 years, where every link in the chain rewards higher prices instead of lower ones. Follow that chain, and the mystery solves itself. Start with the most basic fact. The US spends close to $4.9 trillion a year on healthcare, roughly 18% of its entire economy. No other developed country comes close. Yet on almost every major health outcome, life expectancy, infant mortality, chronic disease, America ranks below nations spending half as much per person. So the money is clearly not buying better health. The logical next question is simple. If it's not buying health, what is it buying? Reason 1, prices are not real prices. In most industries, a price is public and fixed. In American healthcare, almost nothing is. A knee replacement can cost $19,000 at one hospital and $75,000 at another hospital 15 minutes away. Same surgery, same recovery time. This is possible because of something called the charge master, an internal list every hospital keeps, where prices are inflated far beyond actual cost. A bag of saline solution that costs about $1 to make can appear on a bill at $90. Almost nobody pays the full charge master price. Insurers negotiate it down by 50 to 80%. But if you're uninsured, you can be billed the full inflated number. Logic check: if prices are negotiated privately and separately with every hospital, there is no single force pushing them down. That's reason 1 solved. Now, why does this negotiation happen at all? Reason 2, the negotiation itself costs a fortune. The US never built one national system to negotiate prices for everyone. Instead, it built thousands of private insurers, each negotiating separately with each hospital, each doctor's group, each drug supplier. Every one of those negotiations needs staff on both sides. Estimates put total US healthcare administrative spending somewhere between $600 billion and $950 billion a year. That is more than the entire GDP of Sweden, spent purely on billing, coding, and paperwork. Hospitals employ coders whose only job is translating treatment into the billing code that gets the highest reimbursement. Insurers employ reviewers whose only job is challenging those codes. None of this labor treats a single patient. It exists purely because there is no single price to agree on. Logic check complete: fragmentation creates friction, and friction costs money. Reason 3, and this one surprises most people: insurance companies don't always want lower prices. Federal law requires insurers to spend 80 to 85% of premiums on actual medical care, a rule meant to protect patients. But look at the incentive it creates. If a company must spend 85 cents of every dollar on care, the fastest way to grow profit in real dollars isn't shrinking costs, it's growing the total pool of money flowing through the system. Same percentage margin, bigger pie, bigger profit. That single rule, built to help patients, quietly removes the insurer's motivation to fight rising prices aggressively. Mystery deepens, but the logic holds. Reason 4, drug prices. The US is nearly the only wealthy country where a pharmaceutical company can set its own price with almost no government negotiation. Insulin that costs $3 to $6 to manufacture has historically sold for $300 a vial before insurance. In Canada or the UK, one government agency negotiates one national price using the leverage of an entire population. In the US, that leverage is split across thousands of separate insurers and pharmacy middlemen, none of them as powerful alone. Weaker leverage, higher price. Simple logic. Reason 5, the middlemen almost nobody has heard of. Pharmacy benefit managers, or PBMs, sit between drug makers, insurers, and pharmacies. Three of them, CVS Caremark, Express Scripts, and OptumRx, control an estimated 70 to 80% of the entire U.S. prescription market. In theory, they negotiate rebates to lower costs. In practice, many PBMs earn a cut based on a drug's list price, which means, strangely, they can profit when that price rises. An incentive built to lower costs ends up rewarding the opposite. Add that to the chain. Reason 6: hospitals stopped competing with each other. Over the past 2 decades, thousands of independent hospitals were bought up by larger hospital systems. Research on these mergers consistently finds that when one system dominates a region, prices for common procedures rise 20 to 40% within a few years, with no real improvement in care. The logic is straightforward. If there are only 1 or 2 hospital systems within driving distance, an insurer cannot walk away from the negotiating table. They need that hospital in their network. Less competition, more leverage, higher prices. Reason 7: the cost of becoming a doctor. American specialists often earn $400,000 to $600,000 a year, sometimes far more. Medical school debt regularly exceeds $200,000, and training can take over a decade past undergraduate study. High pay is not the single biggest driver of total costs, but it's another cost layered on top of everything else, and it's tied directly to how expensive and drawn out the path to practicing medicine has become. Reason 8: fear of lawsuits. In a highly litigious legal system, doctors often order extra tests and scans, not because symptoms demand it, but to protect themselves if something goes wrong later. Estimates for this defensive medicine range from $46 billion to over $200 billion a year. Multiply one extra scan by millions of patient visits, and the logic scales into real national numbers. Reason 9: spending is not spread evenly. Roughly 5% of patients account for about 50% of total healthcare spending in a given year, mostly from chronic illness, major surgery, or long hospitalization. The entire insurance and pricing system is essentially built around covering these catastrophic cases, and those enormous fixed costs get distributed across every premium, whether you're healthy or not. Now put every reason side by side. Prices that are privately negotiated instead of fixed. Fragmented negotiation that burns $600 to $950 billion a year on pure administration. An insurance rule that rewards bigger total spending over smaller bills. Drug pricing with almost no centralized negotiating power. Pharmacy middlemen who can profit when list prices climb. Hospital mergers that erase local competition. Physician pay tied to extreme training costs. Defensive medicine driven by legal risk. And a small percentage of patients whose catastrophic costs get spread across everyone. None of these forces individually explains a $4.9 trillion number. Together, they explain all of it. This is why price transparency laws haven't fixed the problem. Hospitals were required to publish their chargemaster prices, but studies since the rule took effect show many comply only partially or publish the data in formats nearly impossible for a normal person to read. It's why letting Medicare negotiate drug prices directly, something most peer nations have done for decades, only began in limited form in the 2020s in the US, and still covers a small slice of the highest cost drugs. Single fixes fail because this isn't a single problem. It's 9 separate, interlocking incentives, and removing one still leaves the other 8 intact. Here's what that means for an ordinary person. Medical debt remains one of the leading causes of personal bankruptcy in the US, showing up as a contributing factor in well over half of all bankruptcy filings. A single bad diagnosis, one accident, one unplanned hospital stay, can produce a bill in the tens of thousands of dollars, even with insurance, because deductibles, co-pays, and out-of-network charges still leave enormous gaps. So why is US healthcare so expensive? Because the system was never built by one designer with one goal. It was built negotiation by negotiation, merger by merger, incentive by incentive, by thousands of separate players, each one rationally maximizing its own position. Every other wealthy country solved this by concentrating negotiating power into one national system or tightly regulated model. The US chose competition between thousands of private entities instead, And competition without a shared price floor doesn't push costs down, it pushes complexity up. The mystery was never who is to blame. The mystery was always why nobody had the power to say no. And now you know why.